Right now, we know what the coronavirus pandemic is doing. It is overwhelming health systems around the world, requiring a rethinking of investment into health infrastructure. This country has started its own. Today, we're privileged to speak to former Health Minister, Professor Sipa Yankey, on what, from his perspective, can be done as far as health infrastructure is concerned. Prof. Sipa Yankey, it's very good to see you. It's been a very, very long time since we saw you in the media.
Yes. Thank you very much for having me. Yes, it's been a long time. And let me just make some correction. I'm Dr. Yankey.
Dr. Yankey.
And not Professor Yankey.
Very well. Very well. It's probably a prophecy.
Thank you very much. Thank you very much.
So tell us, how have you been doing, especially in this pandemic?
Well, we've been trying to keep ourselves busy by staying in your house, reading, writing, and exercising. Also eating and sleeping.
So let's look at how Ghana has, I mean, you've been a health minister before. Certainly things might have been different back then when you were health minister than it is at the moment, but you will still have an insight as far as health matters are concerned. First, give me your assessment of how Ghana has handled this situation from our part of the world.
Well, I think the government, and especially the Ministry of Health, has not done badly. They've done quite well. I think they've been able to manage the pandemic quite well. But I think they could have done, some of the issues could have done much better. For instance, I think it took a bit of time for us to take the measures that had been taken. And I'm referring especially to the closure of our borders and then the closure of the airport. These ought to have been closed about 2 weeks earlier. 2 weeks earlier before they were closed. And also, I think that the lockdown ought to have been national. Ought to have been national because, you see, as the president himself did admit, when Accra, Greater Accra and Kumasi and environs were locked down, there were buses and trucks transporting people from these lockdown areas to the other regions, exporting the virus to those places. So that actually was a big loophole that even made the virus get to the regions. So these are the issues that I think we could have done better. You know, when I used to be a health minister, I remember when we had the N1H1, the actions we took were very proactive and prompt. When the virus started in the US, spreading to other parts of America, of Europe, before even the World Health Organization declared it to be a pandemic, I think in sometime in July, August, we had taken certain steps, very proactive steps. The Ministry of Health, together with the Ministry of Agric, met and took a decision to stop the importation of pork products to the country. The Ministry of Agric was supposed to be working with all the big piggery farms to ensure that hygiene and the state of the management of those farms were done in such a way that they will not be affected by the virus. And, you know, I think our efforts, though a bit draconian and a bit prompt, some even said that it was too much. We never witnessed any death in Ghana. I don't recall it was any fatality. As a matter of fact, it came to a point when we had a complaint to His Excellency the President Atamils, the ex-president Atamils. And those ladies dealing the trophy or those fatty pork products were complaining that the business was being destroyed. So the president called me and asked me, is there anything put about it? I did convince him that we need to keep the ban on the position for a while before we lifted it. So that was able to stem the import of the virus into the country. And I think that this government, though, has done well, ought to have been a little more prompt, a little more proactive.
Okay. Well, that is in the past, so to speak. But we always look at the past to guide our present, and so we can move into the future. Looking into the future, what are your expectations of what ought to be done generally?
You know, it is good that through the advice of the president, some local initiatives have been undertaken to provide the necessary logistical means that the Ministry of Health and health workers will need to deal with such a dynamic. I think it's important for us now to be able to implement and improve upon the flu surveillance systems and practices. We don't have to wait for a virus to come to Ghana before we work to deal with it. As a matter of fact, flu or virus will always come. Give us another 5 years, some different virus will come to this country. So we don't have to wait till it comes before we start to work to deal with it. Now, we need to strengthen our health facilities, provide basic health facilities in all the regions and the districts. And that's why it was quite heartwarming when the president said that he's going to build 88 district hospitals to ensure that every district has got a hospital, also build about 8 regional hospitals. Very good idea.
These are supposed to be, Doc, these are supposed to be district hospitals.
Yes.
Right. So you're telling me that you hope. Go ahead, sir.
Yeah, so I'm saying that I hope this will be feasible, because you see, you need the facilities to be able to attend to the sick, be it a victim of COVID-19 or whatever. But I said I hope because I don't see how realistic within 1 year any government, anybody, anywhere can build 88 district hospitals and 8 regional hospitals. It's not possible. But I think the president, maybe he means very well, but I don't believe that what he said could be done. But that aside, I'm very happy that now Ghana is doing things that it was not doing before. One, now the pharmaceutical companies, on advice of the president and also with the advent
let me interrupt you briefly, Doc. You indicate that building of the 88 district hospital, from your perspective, is not feasible. You think it is not
within 1 year? Yeah, no.
Within 1 year.
No.
Even when government has said that because our economy is at the moment, the economy was robust before coronavirus, we're able to afford this intervention. You don't believe the word of government?
You know, if I have to go by the promises of this government, if the promises are anything to go by, I don't have any faith that within 1 year, 1 year to build 88 district hospitals, 100 beds. You know, first you've got to procure the financing. To get the financing takes a process. Just to go and discuss the loan facility from whichever lender. You have to negotiate the loan facility, agree on the terms and conditions, go to Parliament, go to Cabinet for approval, go to Parliament for approval, before you have to meet the pre-disbursement conditions for the effectiveness of the loan. And that will take you about 9 months to about 1 year before you are then able to start even work. If that also needs some design of the facilities, the procurement of the items that you require to really get a functional health facility. So that's what I'm saying. While the president may mean very well in the midst of the pandemic, I'm not confident that that can be, that is doable.
And speaking of which, are you then part of those who say government should focus on the abandoned projects left behind by the previous administration, rather than think of starting new health infrastructure altogether?
You know, there are facilities that are close to completion, scattered around the regions. There are some facilities even in Accra and other places. They've gotten to a point whereby their mode of completion, the cost of their completion, will not be as much as putting up a new hospital all over again. So I'm saying, let's finish what we have already and put them to use. And then, as we begin to begin the process of procuring the funds, which takes so long, we can use available funds that you have now to finish them. During the completion of these facilities, you would be embarking, or you have embarked on the process to secure the loans to finance the new ones. Okay. So by the time the loans are available, you have already put to work some of the facilities which are yet to be completed, And then the additional 88 will then come to complement and make a very great health structure for this country. So yes, government can put up some new buildings, some new facilities for a new hospital, but they must finish what is there, because what have been started is government's money. Taxpayers' money is what have been used to commence this project. So we will need to finish this project, because you see, let's assume that most of the facilities were procured, were financed by loans. Whether you like it or not, you and I are going to pay the loan when the loan matures.
Okay.
So I think government should finish the one that I had completed, and then start some new one. Yes, I agree.
Okay, I'm sure that subsequently we'll be able to talk to you, but just two quick things I want to use to address before we call it a wrap. Today I listened to a member of your party, former Minister for Health, say that there is politicization, assessing essentially how President Akufo-Addo has addressed this issue. He says that there's politicization creeping in there. Some people even say that he's using the platform to sort of launch a certain level of political campaign. Is that what you see from your perspective, and what could possibly be wrong with that if that's what it takes to rally the people behind you?
Yeah, I'm not happy about the fact that we spend money to build an ultra-modern facility like the Bank of Ghana Hospital, which has laid idle for about 3 years. And now, because the situation is desperate, we are now beginning to use it for COVID-19 patients. I'm not happy about the fact that we spend money to build the Lagos University of Ghana Medical Center, and be there lying idle for about 2-3 years, and we are now being forced to use it because of COVID-19. So what I'm saying is that whether President Kufuor, whether President Mills, whether President Mahama has built a facility, the facilities that have been built have not been built with their own money. They've been built with monies from which you and I contribute. So we should make use of them and add to these facilities so they can serve the needs of the people. But before I go, very important issue that I think I need to mention now is this. The COVID-19 is going to leave behind battered economies for most countries. It's going to create winners and losers at the end of it. And I think Ghana, by what we started doing, can become winners after COVID-19 for the future, because now before you were importing sanitizers. Now you are producing our own sanitizers. Formerly, you were importing face masks and PPEs, and now we are producing all of these. So I'm saying that the momentum of producing these items domestically for consumption by our health facilities should be continued, and government should work together with the Export Development, the Exim Bank of Ghana, and these companies, the pharmaceutical companies, the textile company, for us to develop capacity to continue to build these things and produce these things, not only for the use of Ghana, but even to export to our neighbors. Okay. And one thing that the Ministry of Health can do is to place big orders with these textile companies producing the face masks, and be able to get enough to produce and supply every Ghanaian. You are being told that you should wear masks compulsorily. In Boku, in some areas, they can't even find it to buy. So government, to give a boost to the textile companies that are producing these face masks, should place an offer of at least 1 or 2 million face masks and give to people who cannot afford it. Okay. And that will be a boost, not only for the companies producing them, but also a big contribution to the fight against the virus.
Dr. Sipa Yankey, I've run out of time, but we'll certainly make time and have another conversation. I mean, you have also been a finance minister before. We can also talk about the financial implications that this virus leaves for us. Certainly, we'll come back to you. Thank you so much for your time this afternoon.
Thank you. My pleasure. Thank you for having me.
I've been talking to former Minister for Health, Dr. Sipa Yankey there, whose views are that government should buy these masks that are being produced here in Ghana and share them for free for people. It will boost the economy part of it, and it will strengthen the hands of these local companies that are into this production there.